Connected health, we've always been really interested in developing home care 2.0. So if we look at what home care has been for the last 25, 30 years, in many respects, it's simply been moving the deck chairs around a ship that's run aground. So people have been trying to do a little bit of different things, trying to improve things on a more of a gradual basis. But what we realized was we had to get off the ship that had run aground, get onto the island, and really develop a new approach as to what home care actually means to people, both to people in receipt of care, the care delivering the care on the ground, and then the wider health and social care system. Everybody forgets that home care workers will see clients 30 to 40 times more often than any other part of the health and social care system. And that for us represents a real opportunity to improve the health outcomes of that particular demographic. So if you look at our project, our Rural Lisbon project that we've been rolling out over the last number of months, the outcomes and the enhanced outcomes for clients on the ground has been staggering. And we've done this in a quantifiable basis with a comparative test group, demonstrating once and for all that this outcome-based model is better. If you look at how we've arranged our workforce, essentially what we've developed are autonomous care teams. So care workers with real experience and real expertise on the ground on a daily basis who understand that care packages are not task orientated, are not time bound, and they have flexibility in terms of the task and the time they deploy with those care recipients on a daily basis. That in itself is a substantial change, and it's really trusting our care workers who really understand those clients to make decisions on a real-time basis. If you wrap around that a whole new approach to outcome-based models of care, where we use technology and we use new systems and processes to focus on that. So what does the menu of care look like essentially? Well, we spend more time diagnosing and working with the older person to understand what their needs actually are to make them feel better and to make them make their physical health and well-being better as well. So if you look at the technology like Paxana, so a little bracelet, very discreet, allows us to track the movement of those older people and to see are there any patterns that we can learn from. If we look at our whole focus on things like social prescribing, so yes, we can be there 4, 5, 6 times a day if necessary, but how do we get that older person to start thinking about, look, I'd like to engage in my community again. I'd like to go to that walking club. I'd like to go to bingo. I'd like to go to the shops for the first time. And I think once we start looking at that menu of care in that way to provide a much broader range of services and solutions, naturally the outcomes will be enhanced as well.